So many communications professionals are planning their autumn vaccination communications and wondering how they can have most impact with relatively small budgets this year. It's also very difficult as the cohorts of people who are eligible for both COVID and flu, particularly COVID, are relatively small, and some of them are quite hard to target with advertising. Many of the people who are eligible, they've had multiple COVID jabs, and we know the attitudes and appetite for COVID vaccinations has changed. And many areas are seeing very low uptake, even amongst people who are immunosuppressed and often the people most at risk. So it isn't easy to target this cohort with advertising. Allan, how would you recommend people do this?
At Can Digital, we've developed an audience profile covering those with an interest in the Green Book immunosuppressed medical conditions. It's on one of our web display platforms, so it basically means that we can target those with an interest in the conditions. So it's not a precise match, as it will cover people with the conditions, but also those that have an interest, so friends, family, medical professionals, etc. The ads run across websites and in apps. So we have a network of over 9,000 different websites that ads can run across, and many apps as well. We trialled the audience profile for the first time during the spring on a vaccine campaign, and it received good engagement levels, cost per click over just £1. So it's a very cost-effective way to reach a potentially small audience. In addition to the immunosuppressed audience profile, we also have existing profiles for the other key audiences, so over 65s, parents of 2 to 3 year olds, pregnancy. Additionally, we've developed a reference network audience profile, so covering those working within the voluntary sector, etc.
Also, something that I know communication professionals struggle with, and it's a problem for all of us, an ongoing problem. How do you support people to target areas or communities where uptake might be lowest, and often areas that experience the highest health inequalities?
Good question. Can has worked on many campaigns targeting audiences suffering health inequalities. So we've got tried and tested audience profiles focusing on ethnicity, areas of deprivation, using translated assets to reach those not speaking English, and also a BSL audience we've developed as well. And yeah, Can specialises in campaigns for the public sector, so the vast majority of our work will include an element of hard to reach and hard to engage audiences, and also a real emphasis on inequality as well.
Brilliant, thanks, Allan.